We're very aware of patients and their issues with access to drugs. We believe that there are many ways to get patients their medications because in the long run, drugs are a component of total cost of care, and we believe that drug therapy is actually one of the least expensive aspects of care throughout the continuum of a disease. And so while at a certain point of time, patients may have a hard time accessing drugs, be it a co-payment issue, a co-insurance issue, we are working to try to get patients, whatever their insurance situation, the right drug for themselves at an affordable price with the best amount of assistance that we can give that's compliant with all federal and state rules. In addition, we do work with state and federal regulators and legislators to bring this issue to the forefront, because one thing that's not well understood about patient access and drug pricing is that the patient share and contribution is probably about 20 to 25% of the total cost of drug therapy in the country. Costs for hospital care are about, I think, 10 times as much, and yet the patient share contribution is about 0.5% to 1%. And so what we're seeing is an imbalance in the percentage of patient contribution to a particular aspect of their health care. It is coming to the forefront because in drug therapy, the patients are bearing a significant amount of burden. This becomes even further warped when you think about benefit design and you think about how patients who have chronic illnesses, who take expensive medications are treated. They are the ones who are actually paying the co-payments and co-insurances for the drugs for these diseases. And in the present system of rebates, they are essentially paying their co-payments and co-insurances off of list price. Rebates are being given that actually cover the entire population and thus reduce the premium for everyone, but the people who are paying for that are the sick people. So Scott Gottlieb was entirely correct when he said, we have a system today in which the sick subsidize the healthy.